Sharing a few minutes with us on colorectal cancer is Carlea Bauman, the president of the Colorectal Cancer Coalition.
Hello.
Hi, how are you?
I'm fine. How are you doing?
Very well.
Wonderful.
Let's talk about your organization, what the mission is, what the work it is you do day to day.
Okay. The mission of the Colorectal Cancer Coalition is to win the fight against colorectal cancer through research, empowerment, and access. And the way that we do that at C3 is through patient information, through policy work on Capitol Hill, and through research advocacy. And we also directly fund research ourselves.
Carlea, in terms of impact on the working oncology professional, what would that be?
Well, our patient information is designed to support oncology professionals in their work with their own patients. We have a toll-free answer line that patients can call, not to get medical advice, but to get information, answers to their questions about the disease, information that they can take back to their oncology professionals. And we provide that free to them through our toll-free answer line, through our website, and through a printed newsletter that we send out quarterly. Our policy work has actually been very successful this past year in that we've secured additional funding for colorectal cancer research through the Department of Defense. And finally, our research advocacy work, we train advocates, patient advocates, to sit on cooperative groups, NCI committees, FDA committees, to oversee colorectal cancer research and to try to drive better and more efficient strategy for colorectal cancer research.
Carlea, you live in the Washington, D.C. area. I know you're active and focused on what you can get accomplished on Capitol Hill.
Yes. Our two main priorities on Capitol Hill is, number one, we've been working very hard for several years to try to create a national colorectal cancer screening program that is similar to a breast and cervical cancer screening program that's been in place since the late 90s. And we've been trying to get that created for colorectal cancer. Secondly, as I'd mentioned before, the work that we've been doing to secure colorectal cancer research funding at the Department of Defense was a major victory that we accomplished that was solely responsible due to the work that C3 has done on Capitol Hill. And we were able to secure $15 million worth of research money for colorectal cancer.
Are you encouraged by the increased awareness of colorectal cancer and the importance of screening?
I believe that the awareness of the disease, the need to get screened, is out there. It's still a procedure that many are reluctant to participate in. So we are still interested in finding a way to get people screened and to get over that hurdle of people not wanting to get screened. And certainly in the 5 years that C3 has been in existence, we've been able to provide really good information to patients who are living with the disease. And so, yes, we're seeing progress in that area. It's not enough. We're still losing 50,000 people every year in this country to colorectal cancer, and there are still 150,000 folks who are diagnosed with colon and rectal cancer every year.
Carlea, thank you for your efforts. Thank you for spending a few minutes and talking with us.
Thank you for your time. I really appreciate getting the word out about C3.
You got it. Carlea Bauman, president of the Colorectal Cancer Coalition.